This is not an endorsement of this product by the Department of Defense or any United States Armed Service. These are my own individual views and opinions. Hello, my name is Lieutenant Commander George Brand. Today I will be presenting the Human-Worn Partial Task Surgical Simulator, or as it is more commonly known, the cut suit. In my opinion, the cut suit is a unique piece of medical modeling simulation. It combines a task trainer with that of a standard patient with an overlay of moulage. As seen in the picture to the right, the system is worn by an individual. The cut suit has flexible joints at the groin, arms, and abdomen, allowing for full range of motion. The individual wearing this cut suit can still wear his uniform, body armor, utilize his, and carry a pack. In essence, they can still perform their normal tasks during a mission. As the cut suit is 3 simulations in one, it can be used from point of injury care through surgical intervention. The cut suit comes in 2 variants: Tactical Combat Casualty Care and Surgical. The Tactical Combat Casualty Care variant is the streamlined cut suit. The suit is focused on training personnel to respond to the 3 primary causes of preventable death on the battlefield: massive extremity hemorrhage, airway compromise, and tension pneumothorax. In the top left picture, we can see an individual wearing a cut suit along with his uniform and personal protective gear to include his body armor, and he is employing his weapon. He does appear to be a jolly fellow, but that is the cut suit's bulk underneath his body armor. The other pictures show procedures being performed on a living casualty to include needle decompression, occlusive dressing application, surgical cricothyroidotomy, and hemorrhage control using a tourniquet. The surgical variant is a slightly heavier at 35 pounds. The additional weight is from added shielding and placement of modeled organs in both the thoracic and abdominal cavities. The picture attached represents all items included in one surgical cut suit. I want to draw your attention to the lower right and thoracic and abdominal cavities. The black represents the shielding that is provided to protect the wearer during interventions. To the left of the picture, you can see a black triangle. This is the flexible shielding used around the neck during surgical cricothyroidotomies. Above that is the pumping system. Included in the surgical variant, seen here in the black case, are the various modeled organs: livers, kidneys, intestines, airways, and stomachs. Also included are IV arms. The surgical variant allows for procedures such as those listed here. The Marine Corps has been using both the TCCC and surgical variants at Field Medical Training Battalion West, 1st Medical Battalion, and other units. The cut suit has allowed corpsmen and medical professionals to train as they fight, interacting with a live human. Corpsmen are able to proceed on a mission with Marines and utilize their actual corpsman assault packs to perform interventions on the cut suit. More importantly, though, the surgical variant allows for training in our shock trauma platoons and forward resuscitative surgical systems that moulage cannot replicate. Surgeons and emergency physicians, along with their nurses and corpsmen, can use their actual gear and AMOS to perform interventions and surgeries in the tents they would actually use during a real mission. This allows for a better understanding of the gear available and practice in its actual use. I have mentioned the unique nature of the system, in my opinion. By utilizing a standard patient, it allows for a greater sense of realism and personal feedback. A standard patient will need training in the use of the cut suit to simulate non-visible injuries. For example, the patient can use their shoulders to simulate rise and fall of the chest, rise and fall on one side, simulate difficulty breathing, and that way simulate a tension pneumothorax. The suit can be worn on mission, No longer does a squad need to just happen onto a casualty. The Marine in the squad can be wearing this suit, actually performing on a patrol, and become the casualty. Aligned for a dynamic training of not just medical interventions by his buddy, corpsman, or combat lifesaver, but how does the squad perform now that they are a man down? Allows for greater realistic injects in many scenarios. It is reusable with maintenance, but does require downtime for the repairs to the latex to set up. Finally, I did earlier mention shielding. It does come with a blood pumping system and tourniquet shielding that allows for proper tourniquet placement without harming the wearer. The cut suit is manufactured by Strategic Operations based out of San Diego, California. You may remember some television shows from the 90s, such as Desperado, Pensacola Wings of Gold, and Veronica Mars. These were all produced by Mr. Stu Seagal, who is the owner of Strategic Operations. During Operations Enduring and Iraqi Freedom, Mr. Seagal decided to take his Hollywood production talent and apply it to train the military and other government organizations using Hollywood sets. This provided a hyper-realistic training environment. One of the areas his company focuses on is medical training, specifically tactical combat casualty care and trauma surgery. From this focus was born the cut suit. Strategic Operation manufactures the cut suit moulage, provides training in its use and operator maintenance. The company also provides other services such as train standard patients to include amputees, many who are veterans. They also provide mount construction, actors and sets to portray various locales, shoot houses, breaching houses, and more. Here on the slide you can see their website. Thank you for your time.